I'm glad I just
Welcome to the, what are we, October 6th Board of Health meeting. First order of business is to review the minutes. I take it everybody had a chance to look at them. I'd like to make a motion to accept them as written.
Second?
Second, okay. All in favor?
Aye.
All right, motion passes 4-0. Thank you. All right, that's one down. Second order of business, Elliot. Win Waste Innovations Operational. Good evening, Elliot.
Good evening.
Thank you for being here.
Wouldn't miss it. Good evening, Madam Chair, Director Freilich, and the rest of the Board of Health members. So since the last Board of Health meeting on September 8th, the facility operated at 53% blower availability. As I mentioned, we were going into the large cold iron with overlapping annual outages and the start of our turbine overhaul. So since then, we've processed 16,690 tons, generated just under 4,000 megawatts. Those two scheduled downtime events totaled 528 hours, and two unscheduled downtime events totaling 133 hours. I know Mr. Durant, we went back and forth, and Joe. So I think in order to prevent any confusion and just make sure the numbers all stay aligned and good for you, if it works, we'll just continue to provide that bi-monthly report, how it states with the total ash generated and the total ash shipped, rather than me saying like since the last Board of Health meeting and stuff like that. If that works for you, we'll every 2 months we'll get that report right to you guys, and then it'll be all squared away. If that works.
I don't want to speak for the board, it's fine with me. I didn't know where to find it, and I know we did receive the report, but now I know where it is, and thanks.
Okay.
Thanks for.
Other than that, there were no notable events since the last meeting. Just again, as mentioned, we began the turbine outage. So off and on between the boiler outages, we have been venting through the facility silencer. Continued during the cold iron, like I mentioned previous, we had the OEM of the valve come in, do a full inspection on that, replace the trim kit, did all our inspections. Despite the maintenance activities, we've continued to accept municipal solid waste with no interruption to our municipal customers. From a community aspect, we had team members attend Founders Day again this year. And then coming up on the 17th of this month, we'll be hosting a fall event in support of the Boys and Girls Club at the Blessed Sacrament. That's all I got for an operational update.
Thank you. I believe Mr. Duran had a question.
Yep.
First of all, the drag valve, I heard you mention the drag valve, it operated properly?
Yeah, drag valve,
No
it's
noise.
in service as we speak, operating.
Okay, great, okay. So I have some questions on the, having to do with the ash. We were told originally it was gonna be 50% shipped and 50% put into the landfill. And looking at the data, especially like just the last 2 months, 8,330, in July, 8,433 tons generated, 2,787 in the landfill, 5,645 tons shipped off. August, almost the same, 8,424 tons into the landfill, 2,769, and shipped off-site 5,655 tons. Now, I looked at it for the year, just for the last year. Now, the first 6 months, it was about 50-50, but for the last year, it comes out to 61% shipped off-site and and 38.6% put into the Montefiore. Is it 50% or is it 40%? What, I mean, 60%, what is it?
I mean, the target is right around the 50% mark, but it's a little variable based on the hauler, what his availability is, and then it also is affected by boiler availability. So July, for example, was unfortunately a kind of a poor month for us as far as operating goes. So we had more downtime. So we were supposed to generate more ash, so he was able to ship a little bit more to kind of get our totals back to around 50%. Because if you look at since when we actually started shipping, I think we're pretty darn close to that 50% mark. So it's just a little bit, it has a little bit of an ebb and flow to it.
Well, it seemed like just 6 months was 50-50. Then after that, it seemed like, I mean, you have other months there, like November of '24, same thing, 8,000 generated, 2,784 to 5,224, you know, and it goes down. It just seems like it's not 50%. It's not anywhere near 50% anymore. And just curious, like, what constitutes, how much goes into the landfill and how much is shipped off? And you said the trucking, is that the main issue?
Yeah, trucking plays a factor, but like November that you referenced, for example, that was when we had an annual outage. So we had one boiler down for 14 days in November of '24. So when the total generation goes down, he's still going to try and run, I think six loads a day at least. So if we're generating less, that number is going to kind of go up. And then when we have months where, say, we have no downtime, you're going to be under that 50% mark. So it's going to do a little bit of this as we go. But there's also the weather plays a factor, moisture content, all that stuff, his ability to ship because of the moisture content. So, you know, it's something we're constantly talking with him about and looking at.
I just have one other point that was in our tech report last month, and I didn't see it until the day of the board meeting, so I have a question. It says, worth noting that wind waste shared during the inspection that ash tonnage records have been over-reported to Mass DEP. Okay, and so my question is, if it was over-reported, will wind waste be refiling their bi-monthly reports to DEP and fixing the annual report also?
So all the numbers were fixed in that September submittal. So it listed out all the numbers that you received. So it was corrected in that report. But we're not.
Have you reported that to DEP?
That is the report to DEP.
Okay.
So it has been corrected. We're not going back to each individual report, but the numbers have been corrected. And
Okay.
those numbers will be reflected in the annual report as well.
Okay, great. Madam Chair, I'd just like to share, what I did was I took the, what Wind Waste gave us, and I added the last month
Okay.
off your report, and I want to give it to the board and make it part of the record.
Okay, perfect. Thank you. So we have from April 24 then to August
That's correct.
of
That's our
25.
entire shipment period.
That's the entire shipment period, exactly.
That's it. Oh.
Yep. Thank you. Perfect. Okay. Do you have anything else?
Nope, all set, thank you.
You're good. Thank you, Elliot.
Thank you, thank you.
All right, the next order of business is we have tobacco suspension hearings. Now, remind me, are we gonna have,
Yeah, so I think what we can do, Madam Chair, is we can hear some facts regarding the first one at 386 Lincoln Ave.
Okay.
We have Joyce Redford here tonight just to discuss, and then I believe we have representatives of 7-Eleven at 386
7-Eleven here?
Lincoln here, and we can also hear from them as well.
Okay.
Before.
Joyce?
Which order?
7-Eleven first, please.
Okay. So on July 29th, we did
Joyce, would you, I'm sorry, would you
Oh,
mind
sorry.
coming up? Thank you.
I never have a problem with anybody hearing me, but I forget
I know.
that I hit this protocol.
Yeah, thank you.
You're welcome, thank you. So on July 29th, we conducted compliance checks in the town of Saugus. At approximately 11:07 in the morning, we went to 7-Eleven on Lincoln Ave, and the youth asked for frontal leaves, which are tobacco leaves, which have been prohibited in the town of Saugus since 2016. So not only was there a sale, but it was of a prohibited product. The sale was made. It was $7.43. The clerk was a female adult. She was wearing a 7-Eleven shirt, a visor, and had a ponytail, and the store was also selling something called fume, which is also prohibited. The sale was made. It would be their third violation in 36 months, so it's a $5,000 fine and a 30-day suspension.
Okay. All right.
Thank you, Judge.
Sure.
Thank you. So who's here to represent? Okay, could you come up to the podium and tell us your name and how you are associated with 7-Eleven, please?
Name is Joe Ida, franchise owner for 7-Eleven. So, as I mentioned to John before, first of all, I'm not aware of the front door being prohibited from the town. I never received anything in that regard. So, if it is prohibited, then I have no knowledge of it, and it will be removed off the shelf. Being the third violation, the first two, I would have got a letter about that. I know one was like sometime last year, or maybe a little longer.
36 months.
Right, but like the first offense, I never received anything in that regard. And I was never assessed the penalty that otherwise I would have record of me paying that. The issue that I'm facing here is I'm not in the store 24/7.
I understand.
We, as a 7-Eleven program, every employee undergo a certain training, and they have to pass that training. And when they watch videos for tobacco and alcohol sales, which we don't have alcohol, but they go through that. They have to go through like a quiz
Yep.
and
And that's
pass.
your requirement as the
That's
franchise
correct. So
owner to train.
Correct.
Yep,
The other thing is we have our own program,
okay.
the 7-Eleven program, that tells that they like 7-Eleven hire a third-party company,
Okay.
which I pay for as a franchisee, and they send out same thing, a compliance check, and if the clerk or the associate pass or check an ID, they get a green card like this, and I have a whole bunch of them. And when they fail, they get a red card. So the red card, most of the time I don't see because the associate hide it, but I get an email about it. Yeah, I get an email about it, and I know. So every associate that get a green card, I give them $25 gift card as an incentive.
Yep.
Now the people that fail, they go through a suspension the first time. Second time I fire them, which is it's a punishment for the store as well.
Sure.
Because if somebody's working 40 hours now, I'm looking not only to for a violation like this, I'm looking at finding somebody else to cover the hours. Also, 7-Eleven have a POS implemented protection for the sales of tobacco. So when we scan a tobacco product or a lottery product, the system blocks the transaction and asks to verify ID. Now, up to prior to this incident, the clerk would have to either check the ID or override it with age okay. So they look at the person, and if they think that they're old enough, they override it. After this incident, I have made it, I made it, like multiple phone calls and meetings with 7-Eleven to have any tobacco product being sold, we have to scan the back of the ID.
You eliminated the override button?
Correct. So the
awesome.
the override button is gone. So
Gone.
they have to scan an ID, and if there's no ID, there's no sale. I mean, the store is me as a store owner. I know I have a lot of responsibilities, but I've been doing this for over 35 years, in multiple cities. I currently have a store in Newburyport. I'm inquiring another store in Methuen. So if there is a way that I can prevent that more than this, I'm willing to do it. The fact that I'm going to be suspended for 30 days and pay $5,000 fine, I mean, I don't know. I leave it up to you guys. I mean, I'm believe me, throughout my 35 years, I've never got into a situation like this personally. Now we've had issues, and I had an issue in the city of Newburyport, which I plead my case, and they kind of like agree with me.
So let me ask you, you said you didn't remember or you don't have record of the first $1,000 fine?
I don't.
Okay, but you did get a suspension, a violation of the $2,000 fine?
This one here, they said it was my third, but then they,
No, so what I'm asking you is, you don't have a first violation, but do you have recollection of a second violation?
that's what I'm trying to get to. The second violation, they said it was my third, and I went to Lynn, and they turned it back to be the second violation because I never had a record of the first two. So,
Do we have a record of the first or second?
I believe we do. I mean, I'm looking at my emails, and it only goes back to 2023, but according to...
Joyce, do you have any
according to Jo-
recollection? Or
according
do
to
we have
Joyce,
any record of a first or second?
We do, and it was a continuum. What happened in the case of the case at Lynn was, first of all, it was heard before district court, which shouldn't have even been heard by
But can I ask a question?
Yeah.
But when you're referencing Lynn?
Lynn District Court.
Yes, but, for Saugus?
He appealed to Lynn District Court,
I see,
which is the wrong appeal process.
Right.
It should have come here.
right,
And then, because it's state law, it actually shouldn't have been heard in district court, it should have been heard in Superior Court.
right.
The clerk magistrate had never heard this, heard a case of tobacco. And there was a decision rendered, and I can't remember specifically which ones, because I think, if I'm wrong, there were like 5 stores. And at the time, you were on MFL.
Correct.
So there was a lag time in when they were notified. So district court, I don't have the findings
Of course.
because they don't come to me.
Right.
It doesn't mean it didn't happen, it just
Right.
was the court rolled it back. The other issue is, I'll just bring it up as part of this. I believe that in this case, we stacked the fine for the prohibited product and the sale to a minor. And the youth do not, and this is for everybody on the board and anybody listening, the youth do not carry IDs. So there was nothing to be scanned.
Right.
They had nothing that they could have scanned of his POS machine. And he says, going back 35 years, I can't attest to his personal 35 years, but these fines and the suspensions have been in play for a long time, even when we were doing up to $300 fines. But since 2020, this is state law now, and it does go 1,000, 2,000, 5,000. So I believe that he never had a $5,000 fine before, but that's because it wasn't state law.
Right.
so in terms of the violation, like I said, that's the one that I received, this last one, and this like the scan of the ID, we forced that, I was able to get 7-Eleven to force it into the system after. Oh, I'm sorry, after.
Okay.
It's not like, I tried before, and they wouldn't do it for a specific store. They will have to do it for the whole region, I guess. I pushed for it from last time, but this time I made an emphasis that it had to be done. And you know, they were able to, you know, single my store, or both of my stores, for that matter.
I think what is confusing me is that, you know, what happened with the Lynn District Court. And I'm having a hard time speaking to that, and the fact that that was overridden.
It wasn't my choice. I got a letter in the mail instructing me what to do. If I was to appeal the decision at the time, I have to write a letter, and they gave me the instruction what to do, and that's what I did. So I have no knowledge of
So,
Lynn.
Madam Chair, we were issuing the citations in a different format, at which point the ticket book that we have, it's a civil disposition ticket book, and it gives the option to appeal it in Lynn District Court, and so that was the box that was
So
checked.
that kind of puts us as a board in a sort of quandary as to how we can go forward with, I understand, Joyce, that this is a third. However, if it was, I'm at a loss, because it's,
Entirely up to the board.
you know, I don't know, how do the members feel? Because, I mean, he was basically, it was squashed, for lack of a better word. The Malden coming out at me.
I have a question, kind of almost off track. What's the process? I go in to buy cigarettes, 1 foot in the grave, so I'm obviously not, I'm of age. What's the process? You're gonna ask me for an ID?
Yes,
It's
so,
legal that they have to ask for an ID?
yes, so especially,
Everybody.
Every sale,
with,
every time.
yeah,
Has to show an ID?
yep, yep, or they can't,
And what
or it
happened
won't
in
bring
his
it up.
case?
Huh?
It wasn't-
They were not asked.
They weren't asked.
They weren't asked. And so previously to this problem, they could, the clerk could press an override button and say, well, you know, the gentleman looked
Okay.
Yeah.
over 21, so override. Now they can't override it for anybody because of this.
And it's costing us, which is okay, it's costing us a lot of business, because a lot of people that are old, they don't understand our process,
Right.
so they get mad and
It's
they go.
gonna, the people who smoke that are over 21 are gonna just understand
Yeah.
that at some point. I mean, these are the norms that have to be in place for that reason, and that's
Yeah.
what we're all going to have to do,
And
so.
I did bring like proof of what,
Oh, I
you know.
I believe you, I mean,
Yeah.
it's fine. I just don't know, you know, when we become Board of Health members, we have to take into consideration what we have taken, you know, we've decided that we're gonna uphold what we're supposed to,
I understand.
okay? And these things have been, you know, long thought out for how we can have what we want as a tobacco-free environment for our young children. So none of this is taken lightly, and I want you to understand that I sympathize, and I get it. I get that this is how you make money. But I also take our position very seriously as to what we have, you know, decided by sitting here to, you know, try and do. And what we have undertaken is that we don't want young people, you know, taking up smoking.
I have children of my own,
I
believe me,
know.
I don't, you know.
I know, nobody wants to see people, you know, take up, but these things have been, take up smoking, and this has been, you know, really a long time coming. And there's much education gone into it, as far as not knowing what things are not allowed to be sold in Massachusetts. There's tons of information that is constantly being placed at the stores. I know Joyce does a lot of going around. I'm a public health nurse in Malden, and I know the tobacco person in Malden does a lot of education too about the products that can and cannot be sold. And this, as Joyce has told us, is twofold. So I'm sorry, but I am gonna have to, I am gonna suggest to my colleagues that we, go forward with this. And I certainly appreciate that you have taken those measures, really appreciate it. And unfortunately for everybody involved, when this is done with one store and the other stores see that we're taking this very seriously, it's almost like, they say, wow, we really all need to put these things in place. We need to make sure that all our employees check these IDs all the time. Maybe we all need to get rid of that override button, because this is gonna be put, this is in the paper and people know. So as much as I can sympathize with you, and I am very sorry that we have to uphold this, I am gonna suggest to my colleagues, somebody like to, yep,
Is he saying trying to say that it's not his third offense?
Right,
I'm sorry?
If
exactly.
he's saying it's not his third offense, we have to get that straightened out. Because
Well,
it's
we
$3,000
did,
difference.
so it is his third offense,
He's
but,
saying it's not.
So the point of order is that the initial dispute in Lynn District Court, due to the fact that the fine was written on a civil disposition 21D ticket, it was thrown out. So the deliberation would be whether or not this would constitute his second or third based
Right,
off
well,
of that
that
decision.
has to be determined.
that's what I was trying to,
Because you can't find,
so
you
we
can't assume
could,
it's his third if he's saying, if it's been, for whatever reason,
right.
thrown out,
So what-
squashed or whatever, but if it's actually his second offense, we can't find
So
$5,000.
that's what I'm saying, so we could either make it his second offense, or, because it's twofold, the underage person bought a product, and this is what I was asking for a motion on. The underage person bought a product that was illegal to sell, so not only did the person, his employee not ID the person, but sold a product that is illegal to sell in Massachusetts.
No,
And-
in Saugus, that's not in the state law,
Oh,
that's local.
it's local, okay, so I'm sorry, that's my mistake.
No, but that's, and it's kind of our whole collaborative.
Okay.
This happened like in 2016, we voted because it's a thing you roll marijuana with. And that's, again, on the books since at least 2016. He's been an owner since 2016. All these stores that have been operating for this long should be reading these regulations. In terms of state law, we sent out prior to the 2021 enactment date of state law. My program, as well as DPH, sent every retailer notification of the fines and the law. And so this is twofold. It's every person, every time. That's a violation.
Right.
I mean, we're not charging them, but every person, every time, clearly not being done. Prohibited product in Saugus and all the surrounding areas, and a sale to a minor with no ID.
What exactly is the product? It's not a tobacco product, it's a
It is a
paper product?
tobacco product. It's a big leaf. I have it. I have what he sold to the,
I'll buy it from you.
I have the evidence.
Joyce has props.
It's my evidence box. So these are just leaves, rolled up, rolled around, rolled around, rolled around. And it's a tobacco leaf. So they
It's
use.
used as a
rolling-
like what used to be rolling papers.
Yeah, for weed typically, but it's tobacco, so, DPH and tobacco control, like, whether you were using it illegally before the cannabis law changed, or legally now, no doctor is gonna say roll it in tobacco. Like, use paper, use a pipe, use whatever, but that's tobacco. And Saugus voted this, like I said, at least 2016. And it's not a cigar. I mean,
Looks like it, yeah.
once you unroll it, it's just this leaf, it's as long as my arm, and it,
It's considered a blunt wrap.
yes.
Blood wrap,
Just,
oh, okay. Learn something
just for
new.
the records, I acquired that store in 2017, and I swear I never, I have no idea this product's illegal.
Even existed.
We sell a lot of tobacco product, and if you have mailed a letter, I have never seen a letter. I'm not saying you never mailed it, but I've never seen that
The
letter.
state also meant it, but not about blunt wraps, that was a thing, that's your job to read regulations. Whenever a retailer says to me, and this is just me,
I agree, yeah.
I don't know what I'm selling, I'm like, well, thank God it isn't Coke. Thank God it isn't crack.
I mean, I know I'm not selling Coke, that's for sure.
I mean, it's an addictive product. You should know what you're selling in your store. That's the bottom line, in my opinion.
I would think as a store owner, if a new product came in, that you would say, is this legal in Massachusetts?
Well, I do ask if it's legal or not. I do, because we get rolling papers, we get that's, like, that stuff we have.
Wouldn't your distributor know whether it was legal in Massachusetts?
That's what the feedback that I get, that it's legal. I mean, I'm not taking the responsibility off of my shoulder. I'm being up front. It's just like if I conducted the sale, I wouldn't be standing here and arguing this. But
If I may, would, Anthony, if that first one was squashed in Lynn District Court, would we all be in favor of making this the second without Joyce losing her mind?
Well, no, it's the board's decision, and then it would be a 7-day suspension. That would be in line with the
What do
second
you
violation.
feel
Could I,
about that?
can I ask one question,
Please.
Madam Chair, through the, John, when that administrative type of violation, okay, like a parking ticket, basically, okay, that says, did he follow the process according to that?
Well,
According to
with a,
that
with a
notice?
21, with a 21D, you can just check the box and send it to Lynn District, and they will put it on the docket to be heard. And that was the issue, was that the magistrate that was hearing the case had never dealt with tobacco or anything like that, and so it was really kind of a don't do it again, get it out of the court kind of situation. So,
And that's not done like that anymore.
no, and so after the fact, we were given a template violation document, which you see before you, and then that's what we've been using since, and that's been the official document since the change was made. But what I would say is that if that is going to be the board's decision that we drop it from a third to a second, I would just say that due to the fact that this is becoming more and more of an issue as far as, sales to minors, not just with 7-Eleven, but with everybody, that we make it a point to, let folks know that should we move forward with a second violation versus a third due to whatever the situation was with the court, that is no longer the case, and that moving forward, we'll be using this particular document.
Oh,
versus-
absolutely.
And then, again, where he has obviously, and again, I can't, defend or, try to prosecute in my particular position, but what I will say is that he did come forward with an action plan as
Right.
far as, and he did mention that there was a,
The overlay.
the district needs to, chop up the individual franchisees and what have you. So, I mean, I didn't really get into the weeds on that one, but I would make it a point to say that should this happen again, that it will be indisputable that it's a 30-day.
Absolutely.
It's on the record saying that is 100% going to be the case should this happen again. Where, and again, we're talking about, I'll have to look at the compliance reports that Joyce has been providing us, but I do know that in the 5 years that I've been here, the tolling period being 36 months was, prior to that 36 months where we're now disputing the second versus the third, there were prior violations prior to that 36 months. So this is,
And, yeah.
On him?
yeah, so.
On that store
on the
prior to
establishment.
Yes, so-
prior to his taking.
Like I said, moving forward, if this is going to be the decision of the board, that we just make it a point to, to say that this is going to 100% be a situation moving forward where further violations, again, 36 months, we're still going with the CMR and everything like that.
Yeah.
But ultimately, should this continue to happen, that there will be, 30-day suspensions, $5,000 fines, as well as further violations after that, we're considering revocation outright.
Right, that you would no longer be able to sell tobacco
So-
at all if there's more.
No, I totally understand now that, is there a way, and I know that that's a long shot, is there a way that we can hold the associate?
No. No.
Because,
It's not, no, it's your responsibility as an owner of the store to make sure your associates are well-trained and will follow your rules.
If I
I mean-
could, through the chair.
Sure.
If someone who owns a business has a contract with their employee, that can happen. It can happen retroactively, legally. But it isn't as you mentioned, it's not the job of the board to run their business. So
Right.
the owner is held responsible, but you as an individual owner could write a policy where, zero tolerance, you're fired, you can get a promotion, or you have to pay part of the fine. I mean, that's your jurisdiction.
I mean, the firing is probably the easiest and the hardest decision, because like I said, it's just, but I took enough time.
No,
of,
that's fine, but
the board.
when you were asking me as the board, can I say to you, you have to, I'm gonna make the employee? Absolutely not.
Okay.
Thank you for clarifying.
Sure.
So.
Just
yep,
one last thing,
yep.
Madam Chair. You said 7-Eleven has a third party. Does third party know what is legal and illegal?
So
Massachusetts?
well, the problem is, that is legal to sell in Massachusetts, but our district
Not here.
made it.
To answer your question,
So
the third party is just, like the.
Trainer.
They just.
It's like they contract a
Yeah,
trainer.
they send somebody and ask for a tobacco product, and if the associate don't ask for an ID, they get a red card. If they do, they get a green card like that, and.
Well, I guess,
Apparently, we have no leeway on, he's not denying the infraction.
right,
There is a first, second, or third infraction. We have no leeway saying, well, he's a great guy, he's doing what he can. We have to enforce the law.
right.
So our hands are tied. It's either
Well,
what we-
the only thing we have is that, that previously the Lynn District Court
Threw it out.
threw
We're
out that
debating whether
first.
it's a second
That
or
we
third.
can debate that, or we don't have to, because it's truly there truly is a third, first, second, and third, but, we could be kind and say, well, since that happened.
It seems like he's done everything he can do.
He has done a lot, so, I think I'd like to make a motion to move this to a second violation within a 36-month period and a fine of $2,000 and a suspension for 7 days.
I move.
Second,
Second.
all in favor?
Aye.
Aye.
Okay, motion passed to move this to a 7-day suspension and $2,000 fine.
Okay, and I'll get a letter.
Yeah,
and
we'll
just-
send this.
Okay, all right. Sorry for taking out too much time.
That's okay, thank you.
Next.
Okay, so next we have
Gateway News.
Gateway News and Broadway, Saugus.
Again, same date, July 29th at approximately 11:46, sent a youth into the Gateway newsstand. She asked for Eris, which is a vape product. The sale was made and the youth didn't have enough money. It was supposed to sell for $37. She only had $32. The clerk said that's okay, and she took the $32. They also had Frontos for sale, offered for sale, but the youth didn't ask for them, but it is the same product that's there, was observed at Gateway News. And it's their first violation of sale to a minor, which carries a $1,000 fine and a 3-day suspension.
So we've had her,
You're gonna ask me, oh no.
could you please tell us your name?
Hi, this Madam Chairman and rest of the member. Yeah, my name is Altaf Abdul Latif and I'm the owner of Gateway Store.
I believe we spoke with you last
Yes,
meeting.
last week
right?
we
Okay.
spoke.
So, this is the product that happened, so. And this is something that they can sell?
Yes.
Yeah, okay. So this is the first offense for you. Any questions from the board?
First or second?
First? Did you say first?
I think it's 1,003 days suspension.
Yeah.
Am I wrong?
Mm-hmm.
So I had it as a second offense and a 2. That was in the compliance report.
This has, yeah, second offense.
I can look it up right now.
Yeah, okay.
Sorry for the conflict.
No, that's okay.
This is the
That's a different-
first violation?
Maybe.
So a first violation would.
This is his first violation.
So we're trying to figure that out. So in the compliance report we got, it said that it was the
Second.
second.
Yeah.
With a $2,000 fine. He's already paid his fine.
So now we're just talking about the suspension of at least 7 days. You paid the fine already.
In the August 1st memo, Joyce.
And I remember he said that it happened, there's no, yeah, there's no. So when would you start the suspension?
So typically what we do is after the fact, we'll set a date for probably 3 to 4 weeks in the future so they can just kind of make arrangements and what have you.
All right.
John,
What is the date that you said that I said? I mean, you didn't say it, I did.
Let's see, so on August 1st, you sent the compliance memo, Gateway Newsstands, 2,000 plus a 7-day suspension at 1201 Broadway.
Here it is. No, this says 2020. I'm not showing that, so I'll own this. I'm gonna say this first first violation. Violation. Education. We had education visit, and this was 7/29. So this, according to my records here, and this would be my administrative mistake,
Okay.
as it would be his first violation and a 3-day suspension, unless you have a record of the original,
So,
other than my report.
so no, we
Okay, then it's probably a typo, I mean, an administrative issue on my end.
Okay.
on the
So-
suspensions,
so-
what I have here, first violation.
So
doesn't actually-
typically our first violations carry no
Right.
suspension and a $1,000 fine per the CMR. And I'm not sure if it's written that as a minimum suspension in the CMR or not.
It is, that, didn't we meet and that you guys come up with 3 days and vote on a 3-day? It's mandatory that you have a suspension in the CMR.
Okay.
It's the language prior to the section on violations.
Okay.
And I attended Board of Health meetings, if you don't remember that, you never voted on it, you can decide not to issue one because it's not in your local regulation, but it is in CMR, that when is the sale to the minor on a first violation? Let's say he was selling flavored product and it was his first violation. There'd be a $1,000 fine, no suspension. But when it includes a sale to a minor, it has to be a minimum suspension. And all of our collaborative areas, I came to meetings years ago,
Yeah.
asked, and I suggested it'd be a 3-day, because we had already voted in a 7-day for a
Right.
second violation.
Right.
So you'd be in line to do it, because it's state law. But if it was never captured and you're not comfortable, that's another thing for the board to decide tonight. It's got a little more complicated than it usually is.
Yeah, so Joe, I know that we're gonna be speaking a little bit about updates to the regulations this evening.
Yep.
So maybe what we can do, and this is a suggestion to the board, is that typically, and this is, dating back to when we started using the new document, we have not been issuing suspensions to anybody on a first offense and a 36-month
Right.
tolling period.
Right.
So I would suggest that we continue on with that, and then should we decide to
Next time.
move
Okay.
forward with new regulations, we can add that in.
Okay.
Because even the second violation on the piece of
Yeah,
paper I
it's a
have-
mistake.
Yeah,
It should be the
that's a
first,
mistake.
yeah.
So,
Okay. And did the gentleman pay a $2,000?
So what we'll have to do is we'll figure something out as far as a reimbursement of the 1,000, because you were very, so when we appreciate you being quick to pay the citations that you were given, so we'll figure that out offline.
Okay, thank you.
All right?
So you're all set?
Thank you.
Okay.
Thank you.
All right.
Do we need a
Thank you
motion
very
on
much.
that?
Yeah, motion for the first violation. I'll make a motion for $1,000 fine and no suspension.
Second?
Okay, all in favor?
Aye.
Passes 4-0. Thank you, everybody.
So now quickly, one is you don't have to have a public hearing to adopt that language, and I would recommend that we adopt it effective tomorrow.
Absolutely.
first violation of a sale to a minor, and we'll add that to the language, just in case we go out tomorrow and do compliance checks.
So can you, could you do me a favor and send me the language?
Absolutely.
Okay, great.
Yep, in fact, I'll plug it into your regulation
Okay,
and
excellent.
highlight it.
All in
And
favor?
Joyce,
Sorry.
will it say,
It's gonna say first violation of a sale to a minor is currently $1,000 and a 3-day suspension, which puts you in line with state law.
Great.
And if we just say yes, vote on it tonight, it'll be in the language tomorrow, because you don't have to have a public hearing for that, a small change like that.
okay.
Motion to change the language.
Second?
All in favor?
Aye.
Aye.
Passes. I keep saying 4, it's 5-0.
So my next quick piece of information, it's a lot to absorb, but I'll be quick because the FDA stepped up and did something the day after we had a meeting with the collaborative members. And we were talking about how for the last year, myself and one of my colleagues, along with everybody at DPH and Tobacco Control, et cetera, knew that the industry, the vaping industry and the pouch industry have been sending out, so state law required that a manufacturer provide a letter to the retailer stating that a product wasn't flavored. So it's like putting a fox to cover the henhouse. There were lots and lots of letters that came from manufacturers, and they were deceitful, fraudulent, etc. They said that their products were not flavored, and in fact they are. And an example of that will be, and I will have this while I'm talking, I'll show you an image. But these products, these are pouches, you've probably seen them. They're open, so you can open them if you want. These are like little tea bags that you put, kind of like chewing tobacco, only in chewing tobacco you spit it out. This is something you put in the side of your mouth and you swallow this, and it's nicotine.
Oh,
And
isn't that what RFK uses?
It's like
yes,
Zyn.
Yeah.
Yeah,
Oh my
it's
God.
similar,
Yeah.
yeah, it's like a Zyn.
Wow.
and that screams, I'm a peppermint candy.
Ooh.
So we had a letter that we developed and listed all these brands, not just individual products, but brand names. Crave being one of them. These are Crave vape products. Every color represented a different flavor, even though Crave, the company, the manufacturer, said, no, it's just that people like different color products. Every one of these had a different smell, fruit, mint, menthol, etc. So we sent this, we gave this letter to the directors, and I sent them information after the collaborative meeting with an enactment date that all those products would have to be out of the retail environment by January 1st. This week, the FDA sent a letter, well, no, they said they sent a letter. We have not talked to a retailer who's had the letter, who's actually had it in hand. But the FDA said, you can leave here, just throw it there. The FDA sent this, and I'll provide it to the board. And it states that they recognize that all these products that are coming in from China are in fact, and here's another example of a picture of these products, like every color represented a different flavor. So the FDA, now if I can find it, I have like 5 of them, here they are. Here's the letter that FDA sent, stating that they were gonna send, these are the products that they have that are approved, so those are approved at the federal level. And they said, we're gonna send this notification to, or we have sent it as of the fall, to 300,000 retailers. And that in that letter it says, or in that article it says that they say, the FDA would never sell products that have games on them, etc. Because you can get a vape product that has like a game you can play while you're vaping. And they're candy flavored and fruit flavored, and as we know, Massachusetts banned flavored products in 2020, so here's a couple more of these. These are for you. And so now we don't even have to do the work. We don't have to send this to the retailers because it's federal law. The product list you're looking at The one problem with that list, from a standpoint of Massachusetts, is if you notice the Zyn products, which are those pouches, very popular, high level of nicotine, every single one of their products is listed as a flavor with the federal government. So they would all be, in Massachusetts, they would all have to come out of the retail environment. And all the other stuff that isn't on that list for vape, for example, the one you saw that was evidence from Gateway, even though it says non-flavored, all of their products say non-flavored now. Eris kind of pivoted very quickly because their letters said they were non-flavored. We tested them, they were flavored, and then they just pivoted by saying every one of their products is unflavored, and they're all flavored. So it doesn't matter that that even happened, now that the federal government says that that list, which the chair has, are the only ones that can be sold that are vape products. So we're gonna move, we're recommending, or we're going to, the program is going to, send a letter supporting what the feds have released, indicating that Zyn will no longer be available, be able to be sold here in Massachusetts unless they come out with a non-flavored one. Because currently all that they have, according to the feds, is flavored in some way.
Okay.
So I just wanted the board to be aware that we're still going for that January 1st target date, giving retailers enough time to sell down what they have. Enough time for us to inform the distributors that we're following federal law. Massachusetts can and has gone further than federal law by banning flavored tobacco and nicotine products in 2020 because they're kid-friendly. And that we're gonna get all this stuff off the shelves without doing it by us having to identify all these brands. The feds did it already. So,
I guess I didn't do my homework for this meeting. This says non-tobacco nicotine product.
that's right, it is tobacco, it's
So it's
nicotine.
distilled,
It's the
like
liquid.
crack of tobacco.
Yeah, it's the same with the liquid nicotine.
Like the vapes.
It's like this.
There's no tobacco.
It's considered.
No.
It's not
Okay, so
combustible
it's
tobacco.
addictive. So it's
delivery.
addictive. Is it
Oh, yeah.
carcinogenic?
It's got
Yes,
nicotine.
it's nicotine.
Nicotine is carcinogenic.
Yeah. Yep. It's actually one of the most poisonous things that, they used to use it for, they don't even use it anymore, but as, to kill everything.
Weeds.
Like as a chemical
Nicotine.
for green, vegetation.
Yes.
So that's kind of crystallized, that one. That if you look at it, it looks like salt inside, a little softer. But in that other vape product that was evidence, that's just liquid.
Yeah.
And kids inhale it. And it's mixed with glycerin and all these other things, but the addictive component is the nicotine. And by state law, there's no difference, classification-wise, there's no difference between tobacco and nicotine products.
Okay, so
They-
there is not.
No, because it's the nicotine even in a combustible cigarette that is addictive.
Now, what do these things come in different strengths? This says 6. This says-
Yes, and some of them are up to like 35, and
What's a cigarette?
here's the comparative thing, just so you know. This is from, so cigarettes, a pack of cigarettes is equivalent to 10 milligrams, one whole pack, 10 milligrams of nicotine.
So one of these is 9?
If that says 9 on it?
Yeah.
Yep,
One packet is a pack of cigarettes.
yep. The nicotine
I
content.
gotta get a house more. So they have one of these in their mouth all day long?
Yes, and a lot of times they double up on
What do
them.
they do with that? Stick it in.
And it's unrecognizable, like if you're a teenager and you're at school, you're swallowing this, and you're not, it's not creating a vapor cloud, it's not creating a cigarette, like a cigarette smoke, or even a smell. And they look just like breath mints if you're a parent to young kids. They're sitting on your desk or whatever, you go
Oh,
by and you
good.
smell it, and it's peppermint,
Smells
right?
like, yeah.
Yeah, it's gum, it's chiclets, it's a mint, it's something.
Right.
And in fact, it's nicotine. And it is the addictive part. And we have kids who are like double, even adults, but I mean, JFK Jr. He had one on TV. I don't know what brand it was, but that's what he was using.
Really?
Yep. So we're moving to, again, get rid of this. It's like when the state said get rid of this and said the manufacturers would have to provide a letter, they did. shamelessly. And then the retailers were kind of on the hook for having this. And we haven't been fining on it because they have letters, even though those letters are deceitful, fraudulent, etc. And it is a consumer protection issue, and we have talked to DPH, and DPH is talking to AG's office, etc. But then this stuff came out from the FDA, which is just going to help us, because, go right ahead.
So, Madam
Yes.
Chair, through the chair, Joyce, so we don't have to take any action as a board on it, or we don't have to make any notifications?
We're going to notify them. We're going to send retailers a letter on your letterhead. We'll send it to
Okay.
John. John can send it out on Saugus letterhead. We're going to do that with all the collaborative members. My colleagues are as well. And then it hasn't, and when we're out doing educational visits, we'll remind them, we'll be carrying the letter and talking to them. We may not get to everybody, but the letter should. And after January 1st, we'll be fining if you're carrying any of the products that aren't on that list and are flavored.
But we don't have to take any action because it's state law.
It's federal law, yep.
Federal law.
Yep.
Federal law, yes.
So we're gonna be enforcing based on our ability to enforce on state and federal regulations around tobacco and nicotine.
Cool. Thank you.
You're welcome, thank you.
So should we have to make a motion on the 3-day suspension?
So I think we just accepted the language.
I think you did, and you
Okay.
gasped it, yeah.
Yeah, we did.
Yeah,
We
you
did
did.
already.
So I'll provide that to the board. It just helps that it's on, because there'll probably be other components of a regulation that we'll talk about in a bigger way, but that small one that is part of state law should go in, and like I
Great.
said.
Thank you,
it's-
Joyce.
Thank you, guys.
All right.
John,
That
thank you.
was
I
a lot.
apologize
Oh,
for the
no
mess.
problem, Joyce.
Yeah.
We'll get it squared away.
Tobacco queen here.
Yeah.
Tobacco Queen.
Bizarre.
Yeah. All right, thank you, Joyce. Next up, we have Terry with the Public Health Nurses Report. Hi, Terry.
How are you?
Hey, Terry.
No worries. Hi, how are you? Good, thanks. So last month in September, we'll go through infectious disease. We had 82 COVID cases, which is significant because most people either do not test or test from home. So that means that there were 82 people that felt sick enough to actually go to the doctor and get tested. And I'm sure everyone knows someone who felt sick last month with a headache, sore throat. It was most likely or could have been COVID. We had 5 TB cases, which is part of the course. 8 foodborne illnesses, none were related to Saugus restaurants. 3 cases of Hep C, 4 of Hep B, 8 Lyme cases. We had 1 case of malaria, which did not originate in Saugus. And we had 2 cases of pertussis. This has gotten more and more common. Pertussis is also known as whooping cough. Whooping cough is an illness that can spread easily. It's a bacteria that causes it. Most people get a serious hacking cough, or breathing in coughing often causes this high-pitched noise, which sounds like a whoop, which is why they call it whooping cough. Vaccination is the best way to prevent pertussis. It's a 5-series shot and usually starts in infancy, 2 months, 4 months, 6 months, and then around a year and a half, and then usually when they enter kindergarten. I would suggest any new parents or grandparents to definitely get vaccinated because it's very dangerous for newborns and babies that airways aren't developed or small. Last month we had 3 flu and COVID clinics, 2 at the senior center and 1 at town hall. We have 2 more open to the public at Town Hall. Those will be October 20th from 2 to 7 and October 28th from 2 to 5. There will be flyers here at the YMCA and at Town Hall, just as a reminder. The Senior Center had its yearly health fair, and that was well attended. We've also been in contact with the NAN project. Hope to collaborate with them for future projects. The NAM project, I don't know if anyone is familiar with it. It strives to reduce mental health stigma and prevent youth suicide by providing proactive peer-to-peer education through stories of lived experiences to young people in their communities. It's named after a woman named Nancy who was in her final year of becoming a social worker, and she committed suicide. And so her parents started this project. One more thing before, I just wanted to touch base upon acetaminophen. It's been in the news lately. Also known as Tylenol, and I don't know if anyone went to the DPH website, but I will read what they put out there for this controversy that is going on about Tylenol. They say, acetaminophen, commonly known as the brand name Tylenol, is one of the safest and most commonly used medicines to relieve pain and reduce fever in pregnancy. Treating these symptoms is important, as leaving fever or significant pain untreated can be far more dangerous to a developing fetus than taking acetaminophen as directed. The overwhelming body of scientific research has not shown that using acetaminophen during pregnancy can cause autism or other neurodevelopmental conditions in children. Claims to the contrary are simply not supported by highly qualified evidence. Pregnant individuals should always follow the advice of their obstetrician, family practice physician, or nurse midwife before taking any medicine. However, acetaminophen remains a safe and important option for managing headaches, muscle aches, and fever.
Who wrote that?
DPH, Department of Public Health, Massachusetts. And that's all I have.
Thank you.
Questions? Okay.
Any questions from the board? All right, thanks. Terry. All right, John, you're up.
All right.
Public Health Director.
Okay, so,
Short and sweet.
no, sure. So, always, I thought, right?
Yeah.
So, we are at 8 cases of West Nile virus this year in 2025, down from 19 last year at this time.
Great.
Last recorded case in Massachusetts was on the 12th of September in Suffolk County. We're still in a high risk area, and that will be continuing until probably the middle of the month when we get our first hard frost. Obviously, it's been unseasonably warm over the last couple of weeks, so it's extending the season a little bit, but the frost is definitely coming. I'm going to jump around a little bit here. So we have a couple of cease and desist orders for fill operations at the old Continental site and at 6 Bacon Drive. The Continental site brought in a bunch of fill that we are in the process of getting an ID. They need to go before the planning board for site plan approval because of the clearing that they did. We're not sure if they're encroaching on any wetland buffer zones. So we're trying to get a little bit more clarification from them prior to allowing any further operations over there, at least for the site itself. The cease and desist for the building has been lifted, and they're continuing to fit out the restaurant for its next use. But like I said, we're just waiting for site plan approval before lifting hours. We completed the quarterly Region 3D emergency preparedness drills. We were the first to respond out of all of the Cape Ann Coalition, so I'm pretty proud of that. Founders Day was a big success. Our booth, we gave out, like I mentioned before, the off wipes, and we just gave out a bunch of different literature. We talked a little bit about substance abuse and mental health, and it was well attended. The entire time was well attended. The food vendors were all perfect as they set up, so we thank them for that and their vigilance there. We have 2 open housing cases that we are currently awaiting re-inspections on at 21 Mount Vernon Street and 75 Vine Street. We were just made aware that LA Fitness has an expired certificate of occupancy, and they have yet to call for their 2025 pool inspection. So myself, as well as inspectional services, are going to be reaching out to them regarding the expired permits. As Terry mentioned, we have flu clinics scheduled for the 20th and the 29th at the Town Hall, so please be on the lookout for some further press releases for that. The MHOA conference in Springfield is going to be on November 5th through the 7th, and I'll be attending it again, as I do every year. We are looking into new rodent control methods here in town. We're looking to update the scope of work for our current contractor, as well as we're going to be implementing a couple of new pilot programs around town based off of some of the complaints that we've been getting. We're going to try to isolate a couple of the hotter spots as far as rodent complaints that we get. And then the only other thing that I have is, so we've been running into further illegal dumping issues down at the Square One Mall. Between illegal dumping and just kind of the general upkeep of the site, we've been in talks with the property management company Simon, who we're arranging a meeting with, myself, the sanitarian, as well as representatives of their group, just to kind of talk about what the future looks like as far as management is concerned. We have run into a number of issues inside the mall as far as sanitary issues, pest issues, grease issues. So we are again going to be talking to them regarding some of the future plans for what they plan to do with the site, just to kind of get a better idea of what we're going to be looking at down the line. But that's all I really have for you, Madam Chair.
Thank you, John, as always.
Madam Chair, just a couple. First of all, I want to thank Teresa for being there at Founder's Day through the whole day. My God,
She did
that was
great.
really great. Thank you. And you had mentioned earlier, just on the wind side, about making sure the distribution goes to the whole board. Can we?
Yes, so Elliot and Joe, again, what we'll do is, so myself and Maria are copied in on on everything that you submit to the DEP and what have you, so if we could just make sure that we copy the whole board in, that'd be great.
We'll provide you with,
Do you have
no,
because
everybody's
that helps
email?
us with all the stuff, that all the information that we want.
Do you have everybody's email?
They're on the Board of Health website,
Oh,
I believe.
that's great.
Those are personal emails, though, is that how you want them, the report sent?
That's all we have. We don't have town.
So the ones that are made
ones that
available,
are there.
I know we have a few personal emails that
Yeah.
are on there. So I don't know if that pleases the board, I can make sure that the distribution goes to everybody that I contact as far as my email is concerned.
It's fine.
Yeah, so I'll send you something.
Do you have any other updates? Anything not reasonably anticipated for 48 hours in advance of our meeting? Anybody? Any public comment?
Amazon Fresh,
Amazon Fresh.
yeah.
What's, oh, for God's
Where do we
sake.
stand with that thing?
So I know that they haven't divested on the property that they initially had started outfitting, and I know that there was some issues regarding the technology that they were using, but they have not really brought any further action to our attention. So it's kind of just been sitting there. I know that they had, like I said, started updating some of the equipment, just due to the fact that I think they were having trouble kind of the computers or the cameras or what have you were kind of having trouble delineating between like a grapefruit and an orange.
So there's still.
It was
they're still
based
saying
off
they're
of
gonna
weights.
open, but we
Yeah,
don't
so
know.
like I said, they haven't divested on the property, and I believe the plan is still in place to make that into a, but I'm not sure. I wish I could speak to it, but I can't.
Do you have any comment from the public? No? All right, well, so the long meeting, thank you
Yes.
everybody for their patience. When's our next meeting?
So the next meeting, it looks like the first Monday in November will be November 3rd.
All right, well, I would like to make a motion to adjourn until our next meeting, November 3rd. We have a second?
Yep.
Thank you, and all in favor?
Aye.
Okay, motion passes 5-0. Good night, everybody. Thank you.
Everyone.